A man was killed by medical malpractice, but not just any man, a certain man that was loved by the whole entire world. However, it should not have taken a specific man's death to spread awareness on medical negligence. This story was seen worldwide with many false headlines avoiding the truth. On June 25th, 2009, singer Michael Jackson was wrongfully killed due to medical negligence. By being administered powerful surgical anesthetics at home without any proper monitoring or equipment, Dr. Conrad Murray was convicted of involuntary manslaughter on November 7, 2011. Sadly, there are way more cases that happen just like this that are not getting the recognition they deserve due to not being such a global sensation. In the article, written by Theodore Drew and Associates, they dove into the reality of how Michael Jackson's death changed access to propofol. They did state that Jackson's high-profile death promoted institutions, regulatory boards, and anesthesia societies to reassess how propofol was stored, prescribed, and administered, leading to tighter restrictions across the healthcare industry. In my argument, I will be addressing healthcare negligence, the causes of negligence that can lead to it, and how medical negligence cases can be reduced. First, we will be addressing the problem. Medical negligence occurs when the provider does not meet the standard of care, which can cause injury or even death. We see that there are many cases that get overlooked because in the eyes of the medical jury, the cases does not meet all the criteria such as proving the provider did not meet the duty of care, the provider breached that duty, the provider caused harm to the patient, and the provider caused the patient damage. One of the biggest cases that we see is the wrong leg amputation in 1995. There was a major surgical error when the surgeon amputated the wrong leg of the patient due to the miscommunication in charts and on the hospital blackboard. This resulted in a settlement and in a license suspension. The only thing the surgeon got was a license suspension when the man only got his wrong leg amputated. The World Health Organization, also known as WHO, states how the main causes of medical negligence are systemic organizational pressures, human error, communications breakdown, and technological failures. The most common form of medical negligence we see is human error. Ones that we hear commonly are delayed diagnosis, where illnesses get diagnosed too late, where it can lead to disease progression. Duke's Health deeps dive on how inadequate monitoring is a main cause of medical negligence. Failing to properly monitor patients after surgeries and failing to rescue them when their clinical signs worsen, as it can turn out to be too late. Now, after we already identified some of the main causes of medical negligence, we will explore some of the solutions of medical malpractice. AMA Journal of Ethics states how transparent communication, implementing strict electronic health record protocols, and alternative dispute resolutions might help resolve the problem. Now, studies show how sympathetic communication and timely disclosure of errors significantly reduce litigation rates and also help maintain the trust of patients. When we see that a nurse, a doctor, is very sympathetic towards us, communicates extremely well. When we see that there are other healthcare workers that try to understand where we are coming from, what we feel, the pain we feel when we are sick, it gains a lot of the patient's trust. And also having that timely communication, having that effective communication from professional to patient and from professional to other professional, whether it be nurse to doctor or doctor to nurse, we see a lot of trust in the patient being growing exponentially, and we see a lot of those risks reducing. And hospitals also reduce the risk of negligence by mandating root cause analysis. So they see the root of that cause and they try to attack it so that they can reduce that. And structured staff training with meticulous documentation practices so that they can get used to documenting a certain way so that they can lower that risk cause. In this speech, I have shed some light on the medical negligence that is seen around the country and how we may lower those risks. Now it's time to you to ask yourself, have you experienced any form of medical negligence? And what contribution can you make to make that change? My name is Jader Garcia, and this is my speech on how medical negligence is in fact a thing and how it gets overlooked and what steps we can make to change that. Thank you for listening.